Hello, I'm Marwan Aburas. This presentation addresses ADI-7 in the 10 areas of diagnostic interest protocol. This presentation I call the periapical bone the decision-making zone. I selected this title to reflect an everyday clinical reality. When we look at the periapical radiograph, our eyes are immediately drawn to radiolucencies. Those dark areas around the root apex signal disease. These periapical or periradicular, like ADI-7 and ADI-8, often reveal advanced endodontic or a periodontic pathology. Their radiographic appearance, size, shape, outline definition, location, can provide key insights into the disease progression. And you question, is this an initial lesion? Is it long-standing, established? Is it advanced, aggressive? Is there bone destruction? How much opaque? How much loosened? Is there root resorption? These are questions that guide treatment decision-making. And this presentation offers you a structured approach to do that. I will focus on the clinical objective. The first one, I would like to refresh your understanding of the trabecular bone architecture in both the maxilla and the mandible in a state of health and disease. Recognizing different bone patterns before we can accurately detect a pathology, Second, I will introduce and explain apical periodontitis radiolucencies, size-based classification, which I call the ARSAP Classification. This classification is a new one I'm introducing in the academy. It replaces the traditional histopathological labels which we learned in dental school, cyst, granuloma, abscess, etc., and base it on a clinically relevant issue, the X-ray. It's initial, it's established, it's advanced, and each one has specific characteristics, And I will explain that in details into the classification. We have a whole classification on that, but I will discuss that when I talk about the ADI-7. It explores the link between resorption and AP, The results of untreated, established when you don't treat it, you're gonna get advanced and you get resorption. And it's a very important area, the resorption, all right? The third objective I have is to apply the 4R operational diagnosis protocol to each one of the 3 ARSAP stages: the initial, the established, the advanced. How to diagnose them, how to differentiate with them in terms of flare-ups, in terms of emergencies, or just asymptomatic cases. And the most important thing that they are the cause of orofacial pain. Almost in every one of these cases, there is a radiographic story which I will tell, all right? And they all begin with the periapical zone. That is ADI-7. It's a very interesting approach. The lucency is more than a dark shadow, The apical bone is the last battleground in endodontic disease, and that's where you're going to make your decisions at the periapical zone, AD7. Understanding how to read it, correctly and systematically is essential for accurate diagnosis and treatment planning. and long-term success, of course, in endodontic treatment. Okay, so let's go with that. Thank you.